The anterior hip matrix is very simple to perform. All you need is a doorway and a chair, and that's mostly for stability. Okay, so what we're going to do, the anterior hip is the front of the hip. It also comprises the groin and the abdominals. Okay, so from a functional standpoint, it's kind of this whole area, and there's a lot of muscles. What I'm going to do is I want to place one foot up onto a chair. I want to be close to a doorway so that I can hold on. And my down foot is going to move back behind me. And I want to make sure that when I start, my foot starts pointed straight ahead. It's very common for the foot to start toed out. Just try and turn that in and we'll go from there. The motion that you're going to do is this here. Now, as I'm bending my knee forward, what I want to do is make sure that on the back or down leg, that my knee is locked and my heel stays driven down. If the heel does come up, that's okay, but we have to make sure that the knee stays locked throughout the entire motion to effectively stretch the muscles that are in the front of the hip. We want to do this in a matrix, so we're going to go forward to back, and then of course we want to go side to side. So what I can do is I can simply position my foot to the inside and continue to drive. I can position this top foot to the outside and continue to drive. And then we want to accomplish rotation, so I could toe my foot in and continue to drive forward, and then I can toe my foot out and drive forward. Now, that's how we mobilize the front of the hip with the opposite leg. There are other ways to do it, and if this one doesn't work for you, please ask a fitness professional, but we can also use your upper body. I can use my arms overhead to create mobility in the front of my right hip. So I'll get the motion going, and then I'll take my hand, and as I bend my knee forward, I reach my hand up and back. I feel a nice abdominal stretch right into my hip and a little bit into my thigh. Then I'll switch hands. I'll go to the other side. I'll drive this hand back as my knee bends forward. And then I want to go into the frontal plane. So I'm going to come here. As I bend forward, I want to bring my arm over my body. I'll go to the other side. As I bring my knee forward, I'll bend my arm over my body the other way, staying very lateral here. And then rotationally, what I'm going to want to do is as I bend my knee forward, I'm going to take one hand and rotate it one way. And then same thing with the opposite arm. Getting both of these accomplished, I would do them both at the same time. Try it on the other side. If you have one side that's tighter, always do a 2-to-1 ratio on the tighter side.